Hey, Dr. John Mark Chesney here from Simply Physio. We're here just going over some techniques. One is we're going to show just an SFMA style rolling assessment. So we have a patient who, a case that we've been working through, who has predominantly an SI joint related condition, and I know there's a lot of varying opinions on an SI joint. Where people that see it all the time, treat it all the time, and then other people that don't believe it's something that exists. And I wouldn't say I'm on either one of the spectrums, but it is something I typically treat the lower back first. But if there's strong signs of something SI joint, then I'll do some more SI joint related interventions. But this technique is really not necessarily SI joint specific. It's more of just a lumbopelvic motor control issue which this patient has. And so I want to just demonstrate how I use it as an assessment here with Dr. Mike, and me kind of going through how I train that for a patient or a therapist that's utilizing it. So I'm going to go through just my instructions with Dr. Mike, who has not, been instructed with or been around this type of style. So he is very, besides his knowledge as a PT, he has very little kind of understanding of this style, and show you how I teach it and what I look for, and we'll see what we find here with Dr. Mike. So, all right, so Michael, if you wanted to have you lay on your back, just in the middle of the two mats. And so this is how I set it up. Here is on your back. You're going to have your legs straight. Knees flat and both arms overhead. So occasionally somebody may have some issues with the shoulder, or just getting the arm overhead. So sometimes you do have to modify that or accommodate that. But ideally they can get here like Dr. Mike is with his arms overhead. So what we're looking here is we're going to go through your ability to roll, but I'm going to have you do it in a specific way. And how I talk about it is a segmental approach. So we're seeing one segment at a time how well you can roll over. So instead of you rolling all at once, we're going to start from either kind of the hands or the legs, and just to see if there's a different side to side, how much difficulty you have. And then we'll use it as a piece of looking to see just what we find, and also can turn it into a treatment. So what I'll start with is the legs. So for almost everybody, it's easier to roll first with the legs, just merely because of the fact that the legs weigh more than the arms, so you have just a better mechanical advantage. So what we're looking to see here, Dr. Mike, is can you roll, let me get this table out of the way. You got plenty of room. All right, so I'm going to have you roll here, starting on your back, roll towards your stomach. And what I want you to do is with your right leg, you're reaching across, and think about we're wringing out a towel. So I'm there through the spine. So we want to keep so that your right arm should not be moving. So that should be the last piece. It's kind of like the tail, if you will. It's just kind of hanging there. Eventually, it'll pull over as you're rolling. So bring your leg back to the flat. So you're going to be reaching across with your right leg. So we'll get to the point where the leg can't move anymore. And because of its attachment to the hip, it starts pulling the pelvis, which starts pulling the low back, which will start pulling the mid back to the upper back, and eventually the shoulder, you'll get to a tipping point with the pelvis. Now, can you keep reaching over with the leg? And so once you've reached as far as you can, we're having to start to almost reach with your pelvis, right? And you're close to that tipping point. So right here, if you can get the hip a little bit further, we'll get to the point that you just kind of roll over, because most of your body weight is starting to hit that tipping point. But you're having a little bit of trouble here, right?
Right, to keep the shoulder
down? So don't worry too much about keeping the shoulder down. So go ahead and come back to your back. Mm-hmm. So you're not actively trying to hold the shoulder down. What we're looking to do is you're preventing an active participation of lifting through the mid, upper back, the shoulder, right? So it's going to come up. It has to come up if we're going to roll over. but we're looking at just a bottom up approach of organizing the roll by starting with your foot, knee, pelvis, hip in one segment is then pulling the next. Okay, so don't actively push down, but we don't want you actively lifting up either. Ultimately, your upper body's just relaxed. Okay, so try that again there, reaching across. All right, and then you can just push yourself back over. So what I saw there was a little bit of shoulder kind of lift. It looked like you kind of pulled a little bit with your shoulder. So see if you can relax a little bit more of the arm, the upper back, and then reach across with your leg again. All right, so that looks a little bit better here. So go ahead and push yourself back over. And what we don't want to do is use any momentum. So we're not throwing the leg. And so it's more just a slow kind of controlled. We don't have to go super slow. But you're just reaching across. So you're going to get a good amount of rotation through the spine. Keep reaching. You'll hit that tipping point where the hip starts pointing down. Keep reaching across. And that's the piece where you're wanting to lift that shoulder, right? So we're trying not to lift that shoulder and get to that tipping point where you just almost, once you hit that tipping point, you just flop.
Yeah.
All right, you're back okay with that?
Yes.
So again, a lot of rotation we're looking to see just how much difficulty you're having with that movement, right? So then after we do that, 3 or 4 times, get an appreciation for that. Some people may not be able to do it and they just get stuck, and we just kind of make a note and we can come back and give them some more cueing. I'll hold off on that for now. But we just want to get an understanding of, okay, how difficult is that? All right. And then now let's switch to your other side. All right. So again, we're getting appreciation. Is there any difference? Going to the right now. And part of that difference is, again, how you can coordinate it if you're feeling anything different. So again, keep reaching across. And once the pelvis kind of hits that tipping point, you got to kind of pull that leg back so it's not a kickstand just a bit, right? Yeah. So push yourself back. Because if you keep the leg out, it's going to prevent you from rolling.
Yeah.
So it's kind of a smooth motion once you kind of keep reaching. Yeah, you can pull it back right there. Perfect. All right, so we're looking a little bit more at the leg. So now if we kind of focus on your mid-upper back, just really relaxing through the shoulders. So once you hit that tipping point, the rest of the mid-upper back is just is coming along for the ride because of how you're initiating through the leg, right? All right, one more time. All right, good. So go ahead and push yourself back. So that would be the lower extremity initiated roll, supine to prone. So there's 8 rolls that we can do, right? So usually in the first session, what we'll do in this video is just show you supine to prone. And that's what I'll take a patient through. It can be a little bit much, I find, to try to do it all. So I'll just have them work on back to stomach. So now what we want to see, if you want to kind of reposition yourself on the mat, come back down just a bit. We're going to initiate that roll with your arms. Now, most people, they're going to have a lot more difficulty here with the arms. And again, just merely because of the fact that the arms weigh a lot less than the legs. And so that control, it kind of shows up as some difficulty in that motor control. So the piece here with the legs is what we want to see is that Michael is not lifting a leg up or pushing down. So what I'll do here is sometimes I'll get my hand. So if you see here, I'll get my hand underneath his heel, both heels, and I'm just looking to see, like, is he pushing down as he's going, or is he lifting up through the heel? Because I want his legs, I'll just say kind of like wet noodles. I mean, just completely limp here through the legs. And can he roll, keeping his legs completely limp, no muscle activity at all through the legs? No momentum. This is usually where people want to use momentum is with this one because they'll get stuck. So arms overhead. And so you can lift your head too. You won't be able to roll if you don't lift your head, but you're reaching across. Go ahead with your right arm. reaching across your body. You have to lift your head up there too. And you keep reaching, and think about reaching with, your fingers, your wrist, your elbow, the shoulder, now the shoulder blade, right? Kind of pull with the shoulder blade. And then the shoulder blade helps pull your up mid kind of upper back, which then pulls your lower back. Again, we're watching the legs. So that looked pretty good. I didn't see you lift the leg. Oftentimes people will kind of raise one leg up, or you can monitor their quad kind of here through the quads just to see if we're getting a contraction pressing down there through the quad. But go ahead and do that again there, Dr. Mike. Again, you'll kind of hit that tipping point, and what we like to hear right there is the leg literally. So you're kind of holding the leg back. What we should want that once that leg kind of rolls over, you should almost hear this kind of flop because the leg's completely relaxed. You're not resisting that kind of that movement at all. You're not holding it back, but it's kind of again like that tail. And that once you roll over, the leg just is flopping, just very loose. So go ahead and do that again one more time. All right. So I maybe saw a little bit of kind of core engagement, kind of pulling with your pelvis, just a little bit. Where we want to see is that you're not kind of pulling with the pelvis, but the pelvis is getting pulled. Okay. Right? Understand the distinction there? Yeah. So you're reaching with the arm. Just think about keep reaching for that wall, reaching with the shoulder blade, keep kind of reaching, and the pelt. There you go. That looked better. Yep, and you're right there. And the leg just flips over. You feel the difference there? Yeah. Yeah. So you're not actively engaging the abdomen to pull the front of your hip over. It should just be a wringing out of that towel. A ratcheting is another analogy I'll use, is that ratcheting kind of effect. Yeah. Like that. So go ahead and see now, go in the other direction. So, and make sure your other arm's overhead. You're right. Yep. Otherwise you'll get stuck. Looking at the legs there. All right, I was kind of filming the legs. That looks pretty good. I didn't see the upper body, so let me look at the upper body here. All right, just looked a little stiff. Yeah. Right?
I get blocked sooner.
Okay.
Than I do over there.
Right. So what I'd rather somebody do, sometimes they'll start to kind of maybe initiate through the pelvis or for the legs. So what I'll have somebody do is if you feel like a body part kick in that shouldn't, instead of pushing through and continuing the roll, what I'd rather you do is just settle back, like just go back to the starting point, reset, because we don't want to be kind of programming this movement into an abnormal kind of way of what we're looking for. So instead of pushing through, just go back to your back, reset, and see if you can relax the area that was tensing up and just initiate that again. Okay? Is your right arm okay overhead? Yep. Yeah, that one should, just so you're not having to kind of roll over an arm that's in the way.
You don't want me to pull like this?
No.
Okay.
It's really just reaching across with that left arm now.
I'm gonna get...
Lift up with the head, too. And think about reaching with your shoulder blade. Keep reaching. And that right knee is wanting to come up a little bit. So you're keeping that relaxed.
That's super hard.
Yeah. So there's probably a piece here. What I would do with Dr. Mike here is if he's struggling like that, again, what I'd rather do is make it easier for him. And so what we can do here, I want him to not struggle so much. So if I put this pillow, if you want to put that pillow just rolled up underneath the back of your hip.
Just one side?
Yeah, just that side. Because now we're pre-positioning you in a little bit of a roll, right? Yeah. So we've taken away the hardest angle since your hip is already moving towards your stomach, right? So now that should be a good bit easier, and you can feel what it feels like to be more relaxed. So keep pulling with that shoulder, Legs are staying complete. So this should allow you to do with the legs really staying more relaxed. There you go. Does that feel different?
Yeah.
Yep. So I'd rather make it easier so that the movement is programmed into, again, where we're not getting this co-contraction, just the elicitation of this muscle activity through the legs or the pelvis, but those areas can stay relaxed. So what I'd have you do is you fold up that pillow again. So we doubled the pillow and have you do that, 4 or 5 times. And this would probably be his homework, is making sure we make this easier for you so you can really feel relaxed. You're not having to struggle. And then as you feel good with that, then what we would do is instead of doing a folded up pillow, you can maybe just do one, right? But the point's not to fully take it with a pillow. The point here is I want him to roll smoothly, where he's not having to really give too much effort, and he can be relaxed, especially through his lower body here, right? So give as much support as what you need starting off, so we're getting that motor memory of what it feels like to get that full segmental rotation through the whole body. So a few other cues, one other cue that I'll give, so I'll usually start with the pillow. Another cue that I'll give to you is through kind of the head and the face and the tongue specifically is there's a body diagram, you can look it up, called the homunculus. And so it's a representation of the body based off of kind of how much brain space is devoted to certain regions of the body, all right? And so there's certain kind of sensory areas like the fingertips, the hands, where there's more brain real estate, if you will, to those areas. The face, again, is another really strong one, the tongue in particular. And so what I'll have somebody do, just another kind of cue is what I could have you do, Michael, is as you're rolling, even with your tongue inside your mouth, is push your tongue to the right. So that, yep, just like that. So that could be another just cue of capitalizing on what we call the homunculus, of that kind of that real estate in the brain devoted to, and now lift your head too as well, right? But you can kind of just push with your tongue to see if that makes it a little bit easier. So that's another cue I'll give somebody in addition to the pillow. All right. Good stuff, man.